not sure if I can make it. You may have seen or heard her video recently where she spoke, and that is Dr. Ivette Lozano, and I'm going to tell you, she is a patriot. A patriot from a communist country originally and is here in America, and I am so proud that she showed up to surprise us today. She's from Cuban born, right? That's correct. And so here we are today. We're so happy she's here. Welcome.
Thank you, guys. So I want to tell you that I was scheduled to be in Austin, but God wanted me here today. Let me tell you that right now in my office, there is a patient whose oxygen saturation is 60%. I've been taking care of him now for 5 days. He is morbidly obese. He has diabetes, hypertension, and cholesterol, and he has COVID, okay? He cannot breathe. I have a respiratory tech coming to the office. We've got him on O2, not a ventilator, oxygen. When I put him on the oxygen, his oxygen saturation went to 100. The reason I'm a little nervous is because I have one oxygen tank and there's a quarter of a tank left, okay? She's gonna come get him and transport him home and set him up with oxygen. We are not gonna put him in the hospital. He is not gonna die under my care.
Yes.
Okay, let me tell you why I'm here, okay? I'm here because I want to show you how you can protect yourself against this virus. This is not a normal virus. This virus is not acting normal, okay? This virus has characteristics of malaria, okay? The patients that get COVID have fevers, and the fevers come at night, and they have night sweats, okay? These patients, sometimes when they come into the office and I check their blood, and I check everybody's blood, they have problems with their liver. Malaria is transmitted by a parasite. That parasite lives in the liver, okay? What is the medication that people take to prevent malaria? Hydroxychloroquine.
Yeah.
What does this country need to be dispensing every day? Hydroxychloroquine. Why are these pharmacists not giving this medicine, hydroxychloroquine? Why do I have to tell the pharmacist what's wrong with you? What happened to HIPAA? What happened to patients' rights?
Yeah.
Tell me, where are our politicians? Where's Greg Abbott in this?
Yeah.
Where is Ken Paxton? Where are all? The only person that's helping me with this is Senator Bob Hall, and he's not big enough. We need bigger. Now we know that the president is on this medication. That should be enough to make an executive order and immediately release this medication. We have countries that are giving this medication out to all their population for free. We are the United States of America. Why are we restricting this medication? I am furious. I can't do this anymore. I go into the office at 8 o'clock in the morning, and I'm going home at 2 o'clock in the morning, and I am living off of caffeine. And when am I going to trash? I'm going to crash soon. I can't do this. I need other doctors opening their offices and starting to treat these patients, okay? I do not have COVID. I do not have symptoms. I wash my hands. I am cautious. These patients are desperate. The majority of the patients that I see are not my patients. None of my patients are getting COVID. These people are coming in from Arizona. They're coming in from Mississippi. I can't treat these people. It's dangerous for them to travel all these hours to come here. They're having to stay in hotels because their doctors are diagnosing them. And after they've got a diagnosis, they're not treating them. And if these patients go into the hospital, what are they doing? They're putting them on ventilators. And we know that this virus that doesn't act like a virus is tricky. And the oxygen problem that these patients are having is not like pneumonia. They're treating people with pneumonia. This is not pneumonia. This is high altitude sickness. And so how do you treat them? Just like the patient who's sitting in my office right now. You treat him with high levels of oxygen. When he came in, let me tell you about God, okay? Let me tell you about God. I'm a nobody. I'm a teeny tiny little insignificant doctor in the middle of East Dallas, okay? And God put in my office an oxygen tank 10 years ago from a patient who didn't need it anymore. His wife went to meet Jesus and he said, Doc, I want to give it to you. And that oxygen tank came in handy today. God knew I would need it in 2020 when this patient was in my office and he had oxygen saturations of 60. And let me tell you another thing. I don't know how to do an oxygen. I don't know how how to set it all up. I'm not a nurse, but we Googled it, and God showed me how to do it. And when I put that nasal cannula on this man who's been short of breath for 3 days and refusing to go to the emergency room because he doesn't want to die, his oxygen saturation went from 60 to 100 in less than 60 seconds. He feels great. I wasn't going to be able to come here and see you guys. He's fine. I'm communicating with him on the phone. I've got my staff there looking at him. The respiratory tech she's hauling butt to get to my office because she's never seen anybody with an oxygenation of 60%. Let me explain something. When I worked in the ER, we would put people on a ventilator that had an oxygenation of 80 to 85%. This guy's walking around with 60. When he came into my office yesterday, I don't think he even remembers being in my office with me. We stayed there until 2 o'clock in the morning yesterday. We were there until 1 o'clock in the morning the day before. He's sick. And he's sick with something that can be cured with a pill that costs $13. And your government is allowing the Texas Pharmacy Board to restrict this medication. And I'm mad because I can't do my job unless the Texas Pharmacy Board gets its act together. Stop identifying these people. Stop testing them with a blood test if you're not going to treat them. Let's treat them all. Let's go on prophylaxis for everyone. You want to open up Texas? Give hydroxychloroquine to anybody who wants it. Don't force anybody to take it. Let them come and get it. How can you protect yourselves? Wash your hands, right? Wash your hands. Who are getting this? People are transmitting it in families. I've got multiple family members infected. You're not going to get it out here in the middle of, the wind blowing and the sun. Sun helps kill this virus. Now, let me tell you something interesting about this virus. And this is all personal experience because I don't know that much about viruses, okay? This virus likes sugar. It loves carbohydrates. And I have had multiple patients, okay? Multiple patients come in, they go on hydroxychloroquine, they look great in 2 hours. I've told you the story. It's an amazing drug. Within 8 hours, there's no fever. They feel fabulous. 1, 2 days, I'm like, okay, get out of here. I don't need to see you anymore. And then one of my patients had a bowl of cereal, right? Just a bowl of cereal. He was fine. He was breathing fine. He had no fever. He had no cough. He could take a deep breath. And he decided to have a bowl of cereal. It threw him in such a storm that he had to rush back to the office. He couldn't breathe. We had to give him breathing treatments. 3, 4 breathing treatments. He was the first guy that turned the corner. We were there until 2 o'clock in the morning. Guys, I don't work until 2 o'clock in the morning. I was scared. I was scared. He was scared. I was more scared. And then he got better, and we sent him home. And within the next day, he was better. And his fever went away, and his breathing fine. And then on the 5th day, guess what he decided to do? He wanted a cup of coffee with some stevia. Let me tell you what happened. He came back into my office in crisis again. Couldn't breathe, gasping for air. I actually got mad at him. Stop the sugar. Stop the carbs. For some reason, and I cannot explain why, and this is why I'm here. I want everybody to know it, okay? If you're eating sugar, the chances of you getting this is high. If you're on a carbohydrate diet, get ready. Children don't get it. I don't have young people coming into the office. People who are infected that have children in the house, they're not getting it. So we have to watch our diets right now. It's not about looking good and losing weight. My patients, the ones that are really, really sick, the ones that are teetering on going to meet Jesus early, are all diabetics. They're all morbidly obese, okay? The sugar has to be less than 110. I'm going to encourage all of you guys, go buy a glucometer that checks your sugar in your finger. You don't think you're eating carbs? You don't think your sugar's high? Check it. Don't take a risk with this virus because you're not going to find a doctor open. I don't know where they are. They need to come out. Stop telemedicine. Start examining these people. You can't listen to their lungs. They can't breathe. How can you tell that it's getting bad? You take a deep breath. And if you start coughing, that virus is in your lungs and you need to seek care immediately. Call your doctor. If he wants you treated, if he wants you to have a test to see if you got COVID, you tell him, I'll get a test if you give me the hydroxychloroquine. I have a nurse that came in from Houston today, okay? A nurse. She got infected in the hospital. They were very quick to test her. Who cares if you get tested? What we need is to be able to treat this. And I'm telling you, it works. Within 2 to 4 hours, the symptoms are gone. This hydroxychloroquine works. But if you eat sugar, if you do carbs, the hydroxychloroquine will not work. And these are the people that are winding up in the hospital. And we do not want to put them on ventilators. We want to do high oxygen. My patient in the clinic right now is on 7 liters. I have 1 tank of oxygen. I just called before I got on stage. There's a quarter of a tank left. The respiratory tech is coming with another tank. They're going to be there in 20 minutes. I'm getting off this stage and I'm going back to my office, right? He's really sick. But I don't want you guys to get sick. And so what we're going to do is we're going to stop all sugar and we're going to tell everybody and you're going to post it, okay?
Vitamin D levels. Check vitamin D levels.
I add zinc to the protocol. Here's the protocol that I use, and it's working beautifully. If you don't have sugar in your body, if you have your diabetes under control, half of the people that I'm seeing, I'm diagnosing them with diabetes. You guys have to get out and get your blood work done. You can't just walk around thinking you're healthy, okay? Hydroxychloroquine, 200 milligrams twice a day, 5 days. If you're a diabetic and you come in and your lungs are all congested, it's hydroxychloroquine, 200 milligrams twice a day for 7 days. I've only had to put 1 patient on another round of hydroxychloroquine. What do you think that patient was doing? Eating sugar. If you take anything away from here today, stop the sugar, okay? Stevia, the pink stuff, the yellow stuff, the blue stuff. Stop the sugar. Second medication, Zithromax, okay? 250 milligrams twice a day for 5 days. It's an antibiotic. I don't know why it works. It just does, okay? Number 3, zinc. Really hard to find right now. I give 50 milligrams twice a day, okay? I had 1 patient that didn't do well. He didn't buy the zinc. I gave him 2 pills in the office immediately after a breathing treatment, turned around. Zinc, find it. Call these pharmacies before you go to see if they have it in stock, okay? Now, here's something that somebody mentioned to me. Aspirin. I have a doctor in Ohio that called me. He said, the D-dimers are up. I was like, I have no idea what a D-dimer is. It's a $185 test. My patients are poor. We're not doing D-dimers, okay? He said, they do really well with aspirin. These patients come in with fevers, okay? Most of them are low grade, 99.5, 99.9. The ones that are sick, the ones who are diabetic, the ones that are morbidly obese, their fevers are about 101, 102.9. The fevers are high. The fevers are normally at nighttime, okay? No Tylenol for the fever. No Tylenol for the fever because it affects the liver. And we know that the malaria parasite goes into the liver. So no Tylenol, okay? Call your politicians. Call your doctors. Call your pharmacies. I'm putting these pharmacists on notice. I'm exposing them. I'm putting their picture on Facebook. I'm giving the address where they work. These people shouldn't be practicing pharmacy. If they're not going to dispense medications that legitimate doctors write. Listen, I had a lady that refused to fill a medication for a patient who had rheumatoid arthritis because that particular pharmacist said that she saw me on Facebook. Really? So she didn't fill it because of a political inclination? That she should be removed. And she was in Walgreens, and I can't remember her name right now, but how dare her not give my patient the medicine because she saw me on Facebook. That is not how pharmacists are supposed to do this. And I have problems from every single pharmacist, okay? I do not have to give the diagnosis, but I cannot get this stuff filled without the diagnosis. They're refusing, and the state board, the Texas State Board of Pharmacy has written in their mandate, if the physician feels that this is detrimental to the patient of disclosing the patient's medical condition, she doesn't have to. They know it. They see it. And they're still refusing to give the medicine. And here's the deal. If I tell them that I refuse, you know what they're putting? They're writing down COVID. This pharmacist that I talked to you about, she told me, if you change this prescription from a diagnosis of rheumatoid arthritis to COVID-19, I will give it to this patient. This pharmacist took this patient's prescription, and without authorization of the patient, she transferred the prescription to Albertson. That's against the law. The patient did not ask for her prescription to be transferred, right? This pharmacist that I'm talking about in Corinth, Texas, this pharmacist discussed in detail the patient's medical condition with the manager of the store when the manager was asking her and begging her to fill the prescription. And here's what's really funny. So I hope you're listening, pharmacists from Walgreens in Corinth. That patient actually had rheumatoid arthritis, you idiot. That's how God takes care of me. God will take care of all of us. We need Texas open, and we need our pharmacies open. Thank you very much.
Boy, she's a firecracker. Y'all, I'm serious. Y'all need to pray for her. She is really fighting the battle for us, and I'm so thankful for her. We're going to try to move forward, and we have so many great speakers, y'all. I really want you to hear everybody because they all have something so awesome to bring to the table. Yes, ma'am? Is that your phone? Okay, our next speaker is our Republican Party of Texas Chairman James Dickey, elected to be chairman in 2017.